Hello, I want to welcome everyone to another episode of Office Hours, where we explore the latest challenges, developments, and innovations in the healthcare revenue cycle space. I'm your host, Stuart Newsome. I'm VP of Marketing here at Infinix. And today we're going to be discussing mitigating revenue risk in the EHR conversions. As we work through this topic, I do want to encourage everyone to submit questions by accessing the Q&A link within Zoom. So go ahead and put those questions. We may prompt some questions for you as we start the discussion, or if you had a question that you wanted to ask regarding this subject before you even joined, just go ahead and put it in that Q&A box. We'll allow some time at the end to answer some of those questions. So just to get started, as everyone knows, the cost of EHR installations has become a very significant financial undertaking for healthcare organizations. We look at this range from about 6.5 million for something like a 25-bed acute care hospital to as much as 660 million for some of the larger systems. One example is Advent Health. Now, since 2019, and that's only 5 years, spending on EHR conversions has risen by 37%, and that's a pretty significant number. This is reflecting not only the scale of investment required, but also the growing frequency of these conversions across the sector. So today we'll explore how organizations can manage these transitions effectively, really focusing on the minimization of revenue leakage and optimizing charge capture processes. And brought along an expert that can tell us all about that is going to be Kero. He's our Chief Development Officer at Ni2. It's our hospital division. And he really brings a wealth of experience and insight into these challenges. He's been on office hours before, and I can tell you, he knows exactly what he's talking about. So, hey, Ron, how you doing today?
Hey, Stuart, I'm doing great. I appreciate the opportunity to hang out with you again and share a little bit of what we've learned, with as hospitals are going through their conversion journeys, specifically in relation to charge capture optimization.
That's awesome. That's awesome. So, well, we'll dive right into it. I know that there's a couple of facets that seem pretty straightforward, but as we all know, things are a little easier said than done. So with that said, what are some crucial insights you can share for organizations when they're planning or maybe currently undergoing an EHR conversion?
Yeah, Stuart, thank you for the question. So I think we have a number of insights, and this is based on, we've talked to lots of organizations over the last couple of years that are considering conversions, are well into a conversion, and right, they're all hair on fire, heads down, buried with too much to do, to organizations that are post conversion. And what do we typically hear, and what are some things to be thinking about as far as our insights from a charge capture optimization perspective? I'd say the first one I'll characterize as maybe myth versus reality. There's always the optimism that if I move from my current platform to a new platform, my charge capture problems will all be solved. It's partly the grass is greener optimism. That's actually not the reality. Certainly, what we find is that there is different functionality and capabilities within each of the EMR platforms that are out there. And so it may be that some things an organization is missing today will be picked up and fixed in the conversion process. But we do charge capture work for clients on all EMR platforms. And what we find is that the overall financial revenue lift opportunity from fixing revenue leakage is pretty much the same regardless of EMR platform an organization is on. So that's kind of insight number one, is have a more realistic view that you'll fix some things, but you'll also probably introduce some more challenges, and net, you're going to have similar opportunities for revenue optimization from charge capture on all of them. Sure. I would also say definitely there's a downside revenue risk. As I talk to organizations, I find many a year after the conversion still have a lot of people doing manual work trying to find what broke and where they're missing charges. And so, as you just shared how much organizations are spending to go through the conversion process, the last thing an organization can afford is to have further revenue erosion as you get going into the transition journey to the new platform. So, and I think lastly, there's a missed opportunity. Most organizations figure they have and suspect they have a charge capture optimization opportunity, but they don't know how much it is. And so there is the opportunity ahead of the conversion to identify all of your charge capture optimization opportunities across the organization, fix those in advance, and port over those fixes into your build, into your new platform so that you capture new revenue going forward. So I would definitely recommend, as a takeaway, invest in charge capture optimization as a key component that you focus on in your conversion journey.
So that's interesting. So how would you frame how critical it is to include charge capture as a dedicated part of the conversion plan? Are there any case study results to illustrate this?
Yeah, great question. So we have done now more than, I'll say, 75 assessments across organizations of all sizes in many geographies for what is your charge capture optimization opportunity. And when we present those findings, every organization is surprised. I call it a hidden opportunity. It's a suspicion, but no, it can't be that big. We average fully 1.5% to 2% of total net revenues for the organization as that opportunity to simply make sure you're billing for every service you provide to every patient every time. And that is, to many, a shocking outcome, but that is consistent across the country. Some areas, if the commercial contracts for outpatient hospital services are favorable, they'll get more benefit. Some areas where the payers aren't quite as friendly, the benefit might be a little bit less. But I think a reasonable upside opportunity for addressing charge capture is that 1.5% to 2% of net revenues. And what I'll say, that's a mix of things the organization didn't know they could bill for. We find those for every client, as well as initiatives they get it right some of the time, but not all of the time. For our smaller clients, that may be 15 to 20 different charge capture initiatives. But for our larger organizations where they have more complexity, so we have some very large health systems as well that we help, it can be 35, 40 different initiatives where there is an opportunity to capture that revenue by either rebilling that revenue or fixing the root cause of that charge loss in the process. I like to call this unintended free care. Nobody planned to leave something off a claim you could get paid for, so it is truly unintended free care for the organization.
Yeah, that's a great way to put it.
I'll also say you can't find all of this without the combination of technology and experts. The rules for billing are too complex. There's too many claims. And so to make sure that you are truly optimizing all of your charging and charge capture optimization, you really need a solution that encompasses the resources you need in both of those dimensions.
Gotcha. So you mentioned earlier about some of that free care, which equates to that revenue leakage that everyone likes to talk about and recover. So considering most of that revenue leakage occurs in clinical departments, further upstream, what strategies do you recommend engaging these teams effectively in the charge capture process? A lot of people forget that they're part of the process, so it's very critical,
Yeah, and obviously the clinical teams are not revenue experts. Right. They're also very busy and focused, as they should be, on delivering the right clinical care to the patients. So what we see is there are two different business models in the market today for how you address this. The predominant model is a SaaS model, where there are a number of companies that have good technology platforms that they provide on a SaaS monthly fee basis to their clients. They will run the claims every month through that platform. it requires the resources on the hospital's revenue cycle teams to chase all of the output of that. If you have a robust technology platform, many services don't go together all the time. And so that those platforms are designed to generate a lot of false positives. And so you actually need people on the hospital revenue cycle team to review the output and actually go to the medical records to see if those services were documented and provided or not. That's kind of step one. We find that 1.5% to 2% of all hospital outpatient claims are missing a reimbursable service. That's a lot of activity. How the SaaS model in reality plays out for most hospitals, they don't have enough staff and resources to chase all the output, but then they also don't have the broad view or the expertise to get to the root cause fixes. And so it tends to be more focused on, we're going to go rebuild these claims with what we missed.
Sure.
So that's kind of model number one. We think that certainly delivers a benefit to the organization. We have a different approach to it. We actually have a team of clinical experts that all they do is work with our client clinical teams to meet with them, determine why are they missing specifically charges for a specific initiative, and then based on their technology platform for their EMR, what is the best workflow solution to implement so that you capture things, they can capture this correctly prospectively. So there's never a need to rebuild claims, but you have to make it easy for them so that they can do this and just integrate it into their workflow. So it can be changing some of the build in the EMR platform. It can be kind of forms and worksheets or that the clinical departments use. It is very difficult without the expertise to know what's the best way to solve for that. But that is our focus in the charge capture space. And for nearly every initiative across all our clients, with that expertise, we're able to get them to 100% charge capture for those initiatives with their clinical teams.
Oh, awesome. Awesome. Now, shifting gears over to the technical side, given the extensive demands on IT and hospital support teams during these conversions, they just seem to be overloaded. There's always a list. They just want to check the box and move on to the next thing. But how can organizations balance the need for charge capture without overburdening these teams that are already, focused on the conversion as the status quo?
Are you suggesting that IT resources are scarce in hospitals?
Yeah, I guess I am alluding to that a little bit, just from experience. I kind of understand that.
Yes, there is no question that one of the biggest barriers to probably most new initiatives in organizations is just the IT team's bandwidth.
Mm-hmm.
And when you add a conversion into this, it is not uncommon to hear organizations say, we can't take on any new initiatives. We're going to put a freeze on tackling new things during the conversion process. That's certainly one way to deal with this, but our lens on that is our solution is to bring that bandwidth and expertise so it doesn't, right? They can keep doing all the things that they are already oversubscribed to do, and we can bring extra bandwidth and own the data portion of the charge capture, data acquisition, the analysis, the root cause fix in that scenario for them. And so, and if you think about it, the organization has just probably broken their budget with their investment in the EMR and the conversion process. And here you have, for most organizations, 1.5% to 2% of net patient revenues that you could go harvest, which to sit and wait for the whole conversion process, and then potentially wait till you have a lot of data and you've chased all the breakages post-conversion. Mm-hmm. You could be 4 or 5% of net revenues that you could have had during that journey if you find a partner who's able to solve that barrier for you.
Sure, sure. And of course, and you alluded to this just now, but EMR conversions are very expensive, as we noted in the introduction. With all the millions being spent, they can be budget consuming, almost budget breakers, where you're freezing things and you're trying to find that revenue. But how can hospitals find the financial resources to support some charge capture initiatives during this costly transition?
Yeah, well, I think for sure the one thing hospitals don't have when they're in that, in the conversion journey at some point is more budget. So to take on more fixed expenses to the organization is generally not in the cards because the budget capacity is just not there. Having said that, if you have a partner who can work on a contingent basis where you don't get billed until you create revenue you don't have today, so you pay for that charge capture work out of money you don't have today, but you'll have in the future, that is a path to be able to take on because there's no financial risk in that structure and it doesn't further tax the budget process. And so it's a very effective strategy for solving for the financial handcuffs of we didn't have enough money to begin with, and now we're embarking on this EMR conversion journey.
Nice, nice. So then we talked about money, we talked about infrastructure, the technical side of things. So now we're going to talk about timing. So when is the best time to engage help to charge capture during EHR conversion processes?
Yeah, so I will say any time is a good time. The best time for certain would probably be the moment you decide that you're going to start your internal teamwork. That's the time. It's usually, call it a 12-month window pre-conversion, to take a snapshot of your history, do an assessment, understand what your opportunities are for charge optimization, and implement new best practice workflows, fix those today, capture the revenue, and still be ahead of your build in your new EMR platform so that you can take all of those new best practices for those known initiatives and build them into your new EMR platform. So you solve for the past, capture revenue now, and then don't repeat your mistakes or what you were missing in the future in your new platform. That also, if in how we work with our clients, once they do the transition to the new EMR, we can then immediately look at all of their claims coming out in the new platform and find if there's anything else that didn't go well in the conversion from a charge capture standpoint. And there are always things. And this way you don't have to wait a year or 2 years, or maybe never, finding that you used to bill for this and now you're not because there's just too much. And we'll catch those right away. And then again, for that EMR, what's the best workflow changes in that configuration to fix whatever caused those charges to start missing going out on claims. So that's ideal state, but anywhere in the journey is fine. One way, so we're talking with an organization right now, they're converting in September. Well, this is still a fine time for us to come in and assess, because a couple of things. One, they're struggling from a budget standpoint. We'll be able to tell them sooner rather than later how much revenue lift they have a chance to capture going forward. And we'll know what wasn't working in the prior platform and be ready to tackle those in the new platform if it stays broken. Again, probably a few things will get fixed. So we'll start looking at their claims right away and see, did it fix it? Great, then we don't need to do anything with that. But anything that they ported over that doesn't work because it wasn't working before, we'll then be in position to fix those right away, as well as find anything new that was purely the result of the conversion that didn't go as anticipated. And obviously, post-conversion, you can do any of that as well. Certainly post-conversion, I would say, it's nice to have at least 3 to 4 months of operating data in the new platform to use as assessment, so you can have a credible baseline of performance and what is the annual expected revenue lift, but it can be done at any time.
This sounds like this the key is having that assessment in the beginning, understanding where there's opportunities. Go ahead and put that cycle in place in their existing EHR. And then it's almost like while they're going through that process of conversion, you're still making those assessments and those tweaks, because it's almost like living in a house that you're having remodeled, right?
That's
You still have to live, you still have to live your daily lives within that home, and still have to put up with the conversion or with the remodeling. Kind of the same thing here. And then once it's done, you kind of have that punch list. So you have an audit kind of after the fact where you're doing this audit to make sure, okay, well, what's missing? And now that it's a new system, because you're right, I mean, all EHRs kind of have their own ways, especially if it's Epic. Epic is not Epic for everyone. It's so unique and very structured and specific for each client and what their needs are. So now you have to assess it so it's not cookie cutter. So they would have to have some things to make that. So that's very interesting. So as we wrap up, are there any final comments or key takeaways you'd like to leave with our audience regarding, managing the charge capture process during EHR conversions?
Yeah, I think key takeaways are based on our case study results across the country. There is a large, compelling charge capture optimization opportunity, regardless of if you're going through a conversion journey or not.
Mm-hmm.
So if you're going through a conversion journey, it makes sense to focus on that because it'll give some immediate revenue lift to the organization at a time where they're very financially strapped, and understand that your conversion is not going to solve that opportunity for you. It may fix some of the opportunities, it'll introduce some new ones. As I shared earlier, the opportunities exist similarly across all of the EMR platforms. And to put this in a little bit of context, if the lift is the average of 1.5% to 2% of net revenues, that's more than the net income for the majority of the hospitals in the country. This is a significant financial opportunity. And lastly, addressing this upfront mitigates some downside risk, which hospitals don't have the ability to absorb, more financial hits during the conversion on top of the investments they've already made. Also, it will solve for, you talked about that punch list kind of post construction.
Right.
This punch list post conversion without help from a partner will go on for a year or more. And you still won't know how successful you are because you won't know if you have a full punch list. You'll only know what you know about and all of the expenses that go with fulfilling that punch list, in addition to the unknown kind of hidden revenue loss from the other initiatives that they don't discover because people can't find it all.
Right.
So anywhere in the journey, but I would say it needs to have a distinct spot in that roadmap for the conversion process. It needs to have a champion. And then if you're going to get a partner to help you, make sure that you find a partner that can solve for all of those barriers, solve for the IT, solve for the team bandwidth, a partner who knows how to do the build within the platform you're converting to, so that you have a best practice workflow to capture things going forward and eliminate those extra expenses with the punch list, that you can repurpose those folks to higher level opportunities across the organization.
Oh, that's awesome. That's awesome. Okay, well, at this point, we're going to turn it over to our Q&A. So if anyone's out there, just drop some questions in Q&A. We do have one question that really stems from, we just went through a huge conversion and completed it. Is it too late to adjust our new EHR to capture some of the charge capture initiatives that you've been mentioning and talking about?
Great question. I appreciate it. And no, it's not too late. We certainly can, within Ni2 or conduct an assessment. Again, we would need to have enough of a history in your new platform, probably 3 or 4 months is minimum, to be able to establish a a baseline where we can credibly estimate what your opportunity is and validate what percent of the time you're missing revenue across the individual initiatives. But after that, going forward, it is just the basic analyze your data, identify how many initiatives, quantify expected annual benefit based on that sample size, and then carry forward for measurement purposes, what percent of the time for each of those initiatives are you missing the revenue? That's how you can measure how a contingent, what is the delivered benefit, but the future benefit will be based on your actual mix of services for each of those initiatives going forward and not on the past.
Oh, nice, nice. Okay. And we do have another one. It's mainly looking at it. And I think this is a good question as well. Mainly, okay, we have a conversion, and like most organizations, we're going to keep the old EHR around for historical data purposes, which you continue to look back and try and recoup some opportunities from may have been missing in the old EHR. And how does that port over to the new EHR?
Okay, so I appreciate that question. So to boil it down, are there opportunities that you could rebill claims where you've missed a service that are still within timely filing? So the answer to that is going to depend on how long ago did you convert? And so are there claims in the old platform that are still within timely filing? But for sure, you can do that. And when we work with clients, we let them decide while we're fixing things in the new platform, how far back and what claims do they want to rebill? Do they need every dollar? Is there a dollar threshold? Maybe claims over something they missed that's over $500 or $1,000 that they'll get reimbursement for, right? Where do they want to cut that? And we actually can hand our clients a list of validated rebilling opportunities with what they will be able to collect for each of those initiatives.
Nice, nice. Okay, well, I don't really see any additional questions. And Ron, you're a very busy guy. I know you're out there, helping hospitals with their charge capture needs, recovering revenue, but you're also very busy. Not only today, we really appreciate your time being with us today, but Monday, you're actually doing an online webinar for HFMA, and it's unlocking hidden revenue cycle lift, insights and strategy. So I know you're excited about that. We're very excited about that. I believe you can go to the HFMA website. It's free for anyone who would want to join that. So I encourage you to go to the HFMA website, take a look at that, and you can join Ron too, because if you liked what he had to say today, he's really going to blow it away on Monday.
Hey, Stuart, I appreciate that. I'll say I welcome follow-up calls or questions from anybody. We're really passionate about helping hospitals be financially successful in such challenging times. And it is rewarding to be able to make such contributions to the budgets for hospitals that have very good uses, to further the clinical needs for their organization and further help their patients.
Oh, that's awesome. Well, Ron, I know we're going to have you on again. Can't wait to have you on again, and appreciate you again just joining us today. And I really appreciate everyone as always joining us. We always welcome our audience. And as Ron said, if you have any other questions, just reach out to us. And with that, we'll bid you goodbye and see all of you next week.
All right. Thank you. Cheers, everyone.
All right. Thanks, everyone.